Hello, today I will be speaking on the topic Contraindications, Principles of Health and Natural Healing. On behalf of the Adventist Health Professionals Association, Trinidad and Tobago chapter, I am Dr. Sylette Henry-Buckmire. Today, have you ever heard of contraindications? Now, this is anything that is a reason for a person to not receive a particular treatment or procedure because it may be harmful. So you could imagine having a bleeding disorder is a contraindication for taking aspirin because treatment with aspirin may cause excess bleeding. Now, this is contrasted with side effects, and side effects refer to any effect that is not the intended clinical effect of the drug, whether or not these effects are harmful or adverse. So let's consider this. Metformin, which is used regularly in the treatment of diabetes. It is branded and sold under several names, such as glucophage, Glumetza, or even Fortamet. And how does metformin work? It decreases how much your liver makes. Additionally, it decreases how much sugar your intestines absorb, making your body more sensitive to insulin and helping your muscles absorb glucose. Why do we need glucose? Because this is what we use to give us energy to complete the activities of daily living. So let us contrast them, side effects versus contraindications. Remember that the side effect is any effect that is not the intended clinical effect of the drug. So at the top of the list, we have physical weakness being a side effect of metformin. Why is this critical? Because already we know that insulin acts as an usher, opening the door of the cell to get the glucose inside so that it will burn to get energy, right? So you can imagine you are taking metformin in, but a natural side effect of metformin is physical weakness. So that is a double whammy right there. And then you have added to that diarrhea, gas, muscle pain, abdominal pain, nausea, vomiting, heartburn. All of these are side effects. Now let's consider the contraindications. We can recall that a contraindication is a symptom or condition that make a particular treatment or procedure inadvisable. So when a patient has these symptoms or conditions, the contraindicated drug should not be used for this particular patient or client. So therefore, if you're experiencing hypersensitivity, chronic heart failure, which is a direct often result of diabetes, if you're experiencing diabetic ketoacidosis, severe renal disease, myocardial infarction, you are not to be given metformin. Question is, what usually happens in practice? And so, are drugs a panacea? Not at all. We need to be taught that drugs do not cure disease. The drug only changes the form and location of the disease. So, the disease or diabetes is really an effort of nature to free the system from conditions that result from a violation of the laws of health. So, follow the 3 A's. A, ascertain the cause. 2, adjust the lifestyle. Move remove and change any unhealthful conditions and correct all wrong habits. And 3, assist nature in her effort to expel impurities and to re-establish the right conditions in the system. So join me, Dr. B, for natural solutions to eliminating diabetes out of your life. God bless you.